Well, if you remember back in March, we were heading into the first period of a hockey game, which was our analogy for our battle against COVID-19, a very tough adversary who wants to spread quickly in our community. I think we've done very well in the first period. These last 6 months, our community has embraced prevention as a key strategy. You're doing your physical distancing, keeping a hockey stick apart, you're wearing your mask, you're having good hand hygiene, and if you develop symptoms of COVID-19, a fever, a cough, or increasing shortness of breath, you've been getting tested. All of our partners have been working well together, and as a result, we have some of the lowest rates of infection in Canada. The second period is a little more complex because the economy's opening, our schools are opening, our colleges and universities are back. So the risk is a little higher. And we all have to be kind and patient as we go through some of the learning of how to ramp up testing and increase capacity. But our community continues to do very well. I was actually concerned in September that we'd see a sudden rise in cases, and we're having a few at a time. We're easily able to control that within KFL&A. Our rates remain low, even though areas around us are high. All of our partners, I must say, have stepped up as well. So our critical care services in the hospital, the essential services of paramedicine and police are doing well. They have protocols in place. We continue to monitor the health of our vulnerable populations and homeless and have strategies on how best to protect them. We're supporting our families with daycares opening, schools opening, and trying to limit the spread of infection in that environment. We're also trying to allow our businesses to succeed in our community. It's essential that our economy get back and people get back with employment. Our schools are starting to reopen, both elementary and secondary, and we're trying to support them the best we can with good advice on infection prevention and control. The colleges and universities are back and opening, and we have good protocols in partnership with them. Our critical care and hospital partners are contributing to the testing strategy and have made bed capacity available in case members of our community get ill with COVID-19. We're still working diligently with long-term care and retirement homes to try to protect that vulnerable population. Our primary care partners are going to be stepping up with our immunization strategy and having virtual care practices and supporting our assessment centers. Our military have their own capacity for testing and isolation, and the Royal Military College is doing well. And our federal and provincial corrections facilities are doing well. So together, all partners are essential. We want all partners to succeed, to enable our economy and our community to return to a new normal. And from our vantage point, we are doing well. Our rate of infection continues to be a fifth of the Ontario rate, 1/10 of what's going on in Toronto and Ottawa, and we remain a low-risk environment. As we head into the second period, we've done really well on prevention, but many of these partners had been closed. As we go into the second period, many of these are a little more vulnerable. Many of our partners are going to have to endorse and embrace prevention as the key strategy. Early testing, isolation, and quarantine. We've built up improved lab capacity, improved public health capacity, and the hospital is better prepared now than it ever has been if we have a rise in COVID cases. So we're in a very good position. The second period will last October, November, December, January, and it's going to be difficult because immunizations for influenza are going to be an integral part there, as well as the threat of influenza on our community. And then the third period will be starting January, February, March, April, all the way through to spring, at which time we hope we'll get some understanding when the vaccine is going to be available, so we can then, at Public Health, start the vaccination strategy. So there's our second period heading into New Year. Our third period, January, February, March, April, and then we're going to reassess. If we have to go into overtime, we'll do it, but we hope that we'll have a vaccine available in our community. Again, our strategy as a community will always be prevention, 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 and that means all of our partners working well together, embracing that attitude. We've got better use of masks in our community, better use of physical distancing, hand hygiene, and our testing capacity is increasing. I'm very sorry for some of the delays, but we're learning as we go, and the capacity will increase. We've got strategies to do that with our Ontario Health and hospital partners. So we're on the right track. We're doing really well. Stay strong, and we will all get through this together. I have to thank everyone in our community for adhering to the best practices of prevention strategies. Again, and early testing and isolation if you have symptoms. We're all in this together. Any weak link in this chain can make the chain pull apart. So we want all of these areas of our community to be strong, to be united, and to continue to be kind and considerate to each other as we reopen the economy and our schools at a very difficult time. But we're all in this together, and together we will succeed.